Hi ladies, welcome to GOC Grace channel today. This is another time to explore more about our bodies. We will be looking at a health condition known as carpal tunnel syndrome (CTS). We always advise that you consult with a doctor for advice, or you send us a message if you need a doctor's contact. Definition: carpal tunnel syndrome (CTS) is a common neurological disorder that occurs when the median nerve, which runs from the forearm into the palm of the hand, becomes compressed or squeezed at the wrist. This compression occurs in the carpal tunnel, a narrow passageway made of bones and ligaments at the base of the hand. Anatomy of the carpal tunnel. The carpal tunnel is located on the palm side of the wrist and contains 1. The median nerve, which controls movement and feeling in the thumb and first 3 fingers, except the little finger. 2. 9 flexor tendons, which help move the fingers and thumb when any of the structures within this tunnel swell or the tunnel narrows. Pressure is placed on the median nerve, causing symptoms of CTS. Causes of carpal tunnel syndrome. CTS can be caused by various factors, often in combination. Some common causes include 1. Repetitive hand movements, for example, typing, assembly line work, sewing. 2. Prolonged wrist positioning. 3. Medical conditions such as diabetes, hypothyroidism, rheumatoid arthritis, obesity, pregnancy. Fluid retention can increase pressure on the nerve. 4. Injury or trauma to the wrist, for example, fractures, sprains. 5. Hereditary factors. Some people naturally have a smaller carpal tunnel. Risk factors: occupations requiring repetitive hand or wrist motion. Age more common in adults over 40. Female gender: women have a smaller carpal tunnel. Pregnancy. Certain health conditions like diabetes or arthritis. Symptoms. Symptoms usually start gradually and may include tingling or numbness, especially in the thumb, index, and middle fingers, pain or burning sensation in the fingers or palm, weakness in the hand, especially in the thumb, clumsiness or tendency to drop objects, worsening symptoms at night, often waking the person up. In advanced cases, the muscles at the base of the thumb may atrophy, waste away. Diagnosis. Diagnosis typically includes 1. Medical history and physical exam, checking for signs of weakness, numbness, and muscle atrophy. Provocative tests like a Tinel's sign, tapping the nerve to elicit tingling, B. Fallon's test, bending the wrist to see if it causes symptoms. 2. Nerve conduction studies, an electromyography M to assess nerve function. 3. Imaging ultrasound or MRI may be used in complex cases or to rule out other causes. Treatment options. 1. Non-surgical treatment. Early treatment often includes wrist splinting, especially at night, activity modification, avoiding repetitive motions, non-steroidal anti-inflammatory drugs, NSAIDs like ibuprofen, steroid injections to reduce inflammation, physical therapy, and nerve gliding exercises. 2. Surgical treatment. If symptoms persist or worsen, carpal tunnel release surgery is performed. To cut the ligament pressing on the nerve can be done as open surgery or endoscopic surgery, usually outpatient with a short recovery period. Prognosis. Early treatment can often relieve symptoms completely. Surgery has a high success rate, with most patients experiencing relief. Untreated CTS can lead to permanent nerve damage and muscle wasting. Prevention. Although not all cases can be prevented, some measures include taking frequent breaks from repetitive tasks, using ergonomic tools, and maintaining good posture, wearing wrist supports, keeping the wrist in a neutral position, stretching and exercising the hands and wrists. Complications if untreated: permanent loss of sensation, muscle atrophy of the thumb, chronic pain or disability, reduced hand function and strength. Conclusion: carpal tunnel syndrome is a preventable, and treatable condition if identified early. Awareness of symptoms and prompt medical intervention can help avoid complications and preserve hand function. Ergonomics and lifestyle adjustments play a critical role in both prevention and recovery. Always remember that it's okay to ask for help and support when you're struggling with any health condition. If you need additional information, don't hesitate to ask. Look out for our next post on cervical cancer. Please do well to share this post to get to other women out there who may need this information. Follow our channel to always get this informative health posts, and do well to help us by liking our posts. Thank you.